I want to first recognize a difference between what comes to our mind when we say scaling up and what is really required when one wants to spread around innovations and the benefits of innovations. When I say we need to scale it up, and one promptly thinks about the organization whereby it would be scaled up, one promptly thinks of a large-scale organization. And large-scale organizations typically must have some vertical hierarchies in them because there's so many things below, and then some people must supervise the things below and some above that. And that is government, of course, yes, and large multinational corporations also. And we know that from our experience, as you pointed out, Sanjay earlier, or Desh, that large multinational corporations are not able to innovate within themselves. So they look out and acquire other small innovators and so. So there is something about that structure for scaling up that prevents experimentation, something different happening in it, because it, for the sake of its efficiency and control, needs to have things done in a very standard way, like government does. So we must change our paradigm of scaling up when we want large benefit towards spreading around, and use a different term, I would suggest, spreading around innovations and the benefit of innovations rather than a scaling up. Now, how do things spread around, and what sort of organization form would be required to spread around things? Well, think of infection. Things infect other things and it spreads around very fast, uncontrollably sometime. So let's change our paradigms a bit, and then I'm going to talk about some examples of patterns of scaling up. And every process of scaling up does not have to be the same. It depends on what you're trying to scale up. For example, there's some things which can be executed in a controlled environment which you can create. And the thing to be executed in that controlled environment is relatively simple in the terms of the number of processes to be executed. So McDonald's is very good at scaling up its model across the world. Everywhere you create a kitchen with the same conditions, with the same equipment, teach people the same routines, and you can get, as they say, the same standards of McDonald's anywhere in the world. But that is a simpler one. When you go to the Arvind Eye Hospital, which you are studying, what happens in the surgery, the essence of that particular operation or the lens that is used can be replicated and perhaps should be replicated. Of course, there's innovation even in that. But that can and should, that's a part of it. But when you look at how Arvind Eye Hospital has been able to reduce the cost of actual care of an eye patient, that means bringing a patient in and then operating and thereafter the post-operation care, things which are very expensive in other hospital systems. Its innovation really is in the organization enterprise model, whereby it is, in its situation, able to bring these things in. Now, we do know that when Arvind Eye Hospital has gone to other countries where the number of people available outside the hospital and their social backgrounds or education are different, better or worse, the same organization model cannot apply, though you may do the production of the lens and the surgery in exactly the same way. Okay, so as things become into more complex situations with many more variables, like in most of our social entrepreneurship, it becomes necessary to go, if I'm saying gradually, to the other extreme, which you cannot replicate.